I just wanted to point out the big thing. You can read the slide. You don't need to tell me to tell you, but we have about $340 million worth of claims annually. We don't carry any stop loss insurance, and we completely control the benefit grid that we design for our membership. The biggest thing underlying, and I think if you've ever read the book Good to Great, we have one underlying philosophy, and this mission statement really gets to the core of what we're about. We're about providing the highest quality health care at a reasonable price. And everything and every decision we make in the consortium really focuses on that mission. We are made up of equal trustee and labor. There are 12 members of labor on our trustee board, as well as 12 members of management. And if you sat us in a room together, you would have a hard time telling who was management and who was labor. We because of that mission statement, because we all are focused on that one thing. You would not know the discussion and
three
pick out who
unions
was
are PSEA, AFT, and SEIU.
I'm going to let Mike talk a little bit about how we were formed and the history behind it, because he's been there through it all. I'm a little more recent trustee to the membership, so Mike, I'll let you talk a little bit.
Hey, good morning, everyone, and thank you. And I know, like Lauren said, it was a requirement that we come in with our vaccine shot and information that we wear our mask. But thank you for wearing the mask, because if you want to serve me lunch or dinner, I'd be thrilled. I can't stand when I go into a restaurant and nobody's wearing a mask. My God, don't spit in my food. Put a mask on. All right. How many of you people live in Allegheny County? So they're local, Doc. Okay. How many school districts are in Allegheny County? There's 42. Doug, go back one slide. Can you do that? How the hell, if we're the Allegheny County School Consortium, how do we have 71 schools? That's because we're starting to expand. As David said, it's in 8 counties. Why did we expand? Forget what Doug said.
I want to interject. We have never approached one district to come into the consortium. They have knocked on our door. If they knock on our door, we'll certainly open it. But we do not solicit or market our services.
And that came straight from our attorneys. So David will keep us in line with all of the information that has to be required from our attorneys. He's right. We do not market. We cannot market. We can't rob another group or another consortium. So we have 41 schools. We have 71 schools in the consortium, and we don't market. They come to us. Because why? What Dougie said about quality health care at the most reasonable price. So, how many people in the room actually work for an insurance company, or are we not working for insurance? Okay. Well, Doc, you do, but you don't do. Somewhat you do. Here's the problem. Nobody shares information. I don't care what you tell me. Information is lacking. You wouldn't be in this conference if you weren't trying to pick up information. The 41 schools all had different plans. They all paid different rates. Doug, what do you have to do with Walt Machowski this month?
What do you mean?
Negotiate. You have to.
Oh yeah, we have to negotiate.
How long have you been waiting to negotiate?
Well,
yeah, a long time. So, well, if you live in the city of Pittsburgh, I'll never forget, I was helping the city of Pittsburgh board with their healthcare renewal, and they got it done. I said, oh, congratulations. I said, that'll be good for another 3 years. He said, no, 3 weeks. I said, what the hell are you talking about, 3 weeks? He said, Mike, well, we just agreed to with the contract 2 years ago. So we're in the retro, and that's what was happening in the 1980s. 42 school districts paid different rates. Nobody would share the information. And the only one that made out of that was the insurance companies, because they were making money on the 42 schools being separated. Their admin fees were high, the stop loss fees were high. So Dave's right. They went to the Heinz Foundation and they asked, well, quite honestly, Teresa Heinz for some money. She kicked in money, and then what the schools did, every school that entered, and it didn't start with 41, it started with like 35, added 7% on their premium. And so with the Teresa Heinz, the Heinz Foundation through Teresa Heinz, and the 7%, we started forming a Taft-Hartley consortium-like group, all right? And what this actually did was we were able to bring, you know, Doug's in Bethel Park. Dave lives in the city of Pittsburgh. I live in South Fayette. Not everybody is in Upper St. Clair, Mount Lebanon, all right? We've got the Stowe Roxas. We've got the Wilkinsburgs. We've got East Allegheny. They're all in this group. And what did we do when we banded together? For the last 20 years, our rate increases have been less than 5%. So it worked for those distressed schools. It worked for Doug and Walt. They could take the benefits off of the table. They're not allowed to individually come into a plan. They have to pick our one plan. We only have an EPO and a PPO, and both in-networks are identical. There is no different variance. You can't pick a $5 copay here, $20 copay here. Dave, what's your favorite saying, which was the last thing on the slide about benefits? What do you say when you bring group in?
The lowest paid person who's entitled to health care benefits at their district has the same plan as the highest superintendent. We have no distinction between the two. And when a district comes into our consortium, everyone comes into the consortium or they don't come in. That includes their retirees who are out on an ERI, early retirement incentive.
So we got the whole kit and caboodle, and we're able to try to work with that. So we have, again, Dave, what's your other favorite? We're bigger than who?
U.S. Steel. Thank you, Hyman Roth.
Well, because now we're over 24,000 employees. We got 61,000 belly buttons out there. And I hate to say that we're doing great, but my God, we're pushing $400 million in expenses a year. So it's a law of numbers. But all of a sudden, in the early 2000s, like 2003, 2004, 2005, we started seeing rising costs again. All of a sudden, we had companies, not only the school districts, but they wanted to start shifting the cost to the employees. And again, as David says, the PSEA represents the bus drivers, the janitors, the cafeteria workers. How much more could they shift? They can't. They're not making that much in pay. So we had to figure out what was important to us. Keep going, Doug. You want to pick up on this, Doug, or you want me to keep
Well,
going?
I think part of what happened then was that we knew we had to change what we were doing and how we were doing it. So we began about looking for other resources and educating our trustees. Did we want to balance a high deductible plan, higher costs for the employees, and avoid and risk them not getting the care they needed? And we really have a philosophy out of the education that we really need to push people to get their primary care, to get their preventative checkups, to make sure they stay healthy. So a lot of our focus became around how do we find good quality providers, where's the data, can we get a hold of the data to tell us who's best? Because we, at that point, when we were first starting, saying, well, who are we going to partner with? There's UPMC out there, there's Highmark out there, AHN, and we had to look at that data. So we got through PBGH, we connected with some people that helped us partner and retrieve data, partners like Innovu, Comparian at the time. I don't know that they exist anymore, but
Imagine Health.
Imagine Health.
Now, I work for Aon. Imagine Health was owned by Tower's parent, but we still hired them, and we looked at them through the PBGH. Now, one little note about PBGH. We're labor. They wouldn't let us in. We finally got a trustee by the name of Jim Gill, who worked at Dollar Bank, that said, how can you not let this large jumbo group in our plan, because they're representing such a big community? So we got into PBGH. David and I go to Pittsburgh Business Group on Health, or the Pittsburgh Business Times meeting, and we're here today. Larry invited us today, so we'll attend and hopefully pick up more information from one of the meetings in here.
Yeah, so there was a lot of data collection, a lot of discussion, how we were going to design the plan. So the trustees really decided at that point we were going to focus on quality measures. We were going to look at tiered products. We were initially told you couldn't do a tiered product. We ran into some people that were developing tiered products at the time. So we developed a tiered product. We looked for, again, quality and education of our memberships to keep them healthy. You want to talk about this one?
Okay, now listen, these are just two random hospitals in Western PA, but this is truth. So, our number one hospital had 235 inpatient visits, 2,900 outpatients for a total of 4.8 million. The ranking hospital number 23 had 212 inpatient stays, almost the same outpatient, but we were paying them $15 million.
And this was all before we did our plan design. So.
And so this was the quality rankings that we got from Quantros. And Quantros came out of CareCheck. And CareCheck is information from Medicare, CMSI, or it's from Medicare and Leapfrog, and all of the ones, they roll it up and come out with this. So this, we knew we had to do something because the costs here were crazy for us to keep paying. Go hit the next.
So then we developed a new plan. Go ahead, Mike.
No, and we developed a new plan. So we went to a tiered product with the help of Towers Perrin and Imagine Health.
Michael,
Go ahead.
I'm just going to say, when you talk about this, don't you need to talk a little bit of the political times that
Well,
caused us to do the tiered product? I have to interject that we have been extremely lucky and a little bit nefarious in our dealings with our health carrier. You all understand or remember the divorce between the Highmark and UPMC. We were able to take advantage. It was the decision of the trustees to go with the one over the other. And it was to our benefit to do so. And that also helped the carrier, and Dr. Blandino from AHN could jump in there if he wanted to, about how our consortium worked mutually with them. And that was because, as Mike's going to explain, we were then able to come up with a tiered plan and have the in-network and out-of-network issues.
I am not in this plan. I wish I was in this plan. So when we did the tiered network, in order to push the people into the correct networks that we wanted, the enhanced tier has no deductible, pays at 100%. How many people in this room have a $0 copay for your PCP? Not I. All right? They do. All right? So we've made everything in 100% other than the specialist, and maybe not the emergency room, but MedExpress, we made it $10. And so the second tier, or the middle tier, that maybe were okay hospitals, the quality wasn't quite up there, we put them at 80%, and then if you were out of network, it was 50%, which really nobody could afford it. Go ahead, Doug.
Yeah, the theory being that we would drive them into the better quality, lower cost hospitals and doctors. So that was the result of what happened.
So,
And an example of that is within 3 years, the number of births from our members from McGee Hospital under the UPMC plan went down to 0. All our births have been at Jefferson, West Penn, and Washington Hospital.
and St. Clair. But then this is what ended up happening. This is a regional hospital, not within the city limits. And this was the hospital that we were actually paying quite a bit to. We actually got an increase of 122%, and the city hospital went down by 82%. But what ended up happening, if you can see, that we increased inpatient and outpatient, but our costs didn't reflect that. So we actually, what we ended up doing, because of our school districts being in all the surrounding counties, we actually got people to stay in their local community. So the biggest employer in Butler County is Butler School District. Well, we have Butler School District. They're keeping all their claims locally. Now, if they need something, sure, they'll come into the city, or they'll go to Cleveland Clinic or what have you, but they're keeping all of their healthcare dollars in the local facilities, which is what we wanted them to do. How did we do it? Go ahead, Doug.
Well, after partnering with Highmark, this is kind of the structure of how we're set up. We have the board, and then we obviously have consultants from Aon. We have our auditors, our legal people. AMCA is our provider, because remember, we're our payer. They're our internal accountants, so to speak, because they handle all the transactions. We pay claims weekly. Remember, we're paying dollar for dollar claims. We're not fully insured, so AMC handles that type of thing. And then we have our direct providers through the Highmark network. We have vision benefits, we have dental benefits, but then we started partnering with all these other types of services, Anovu, so we could get the data, the quality data, and track even our utilization and our claims history. That helps us make decisions about how we're going to design benefit plans from one year to the next and establish rates. We partner with a group called Advanced Medical, who gives us second opinions for our membership. So if they have a complicated case and they want a second opinion, this is all free to our employees. These are services we provide. We provide districts with an EAP, an employee assistance program, if they need counseling. That EAP also supports districts when they might have a teen suicide or a tragedy in their school district. They go in and provide counseling. They help our staff and our students.
But I don't think a school district like Duquesne, East Allegheny, Wilkinsburg could afford to have purchased that if they weren't in our consortium. We're able to give them that type of benefit.
And with all the stresses and everything caused by COVID, the EAP has been very helpful in dealing not only with the children and the members, but also the staff. We kind of forget that the staff is under a little bit of stress right now trying to teach.
EdLogix and ShareCare is two of our wellness partners. So we provide wellness programs to our employees and education services through them. We have Community Health Magazine, where we put out quarterly to our staff members, as well as our website and an app that provides them an abundance of knowledge and different things about the services that we provide and the vendors we use. We more recently partnered with Integrity Pharmaceutical Advisors because we're looking now at PBM models, which is the trend, and pharmaceutical. We have a lot of savings we can capture in that area, so we work with them to issue RFPs, and we'll talk a little bit about that in a couple slides. And then Livongo is a diabetes prevention or control program where they provide strips and
the meters.
Monitoring meters and everything is free to our employees to help them get their diabetes under control. We also had partnered in the past with a group called Healthcare Blue Book. That was a service that allows us to find quality providers, and if you as a member go out there and use their service and find a quality provider, you actually get a check back. Let's say you're getting a knee surgery or a knee replacement done, and you use one of the people on that checklist. Not only do we pay for your coverage, but we'll also send you a $500 check in the mail for picking a high-quality, low-cost provider. So we encourage people to kind of take control of their own health care.
Just a little levity. Michael, what's the most important thing that we get from EAP?
Oh, God. All right, listen. I don't go to bed until 10:05 because at 10 o'clock I either put Fox to the News on 7 or on 3, which is our CBS here locally, KDKA. And I have to, for 5 minutes, I watch the TV. Is one of my school districts on strike? Did something happen at one of my school districts? Number 3, did one of my superintendents get arrested for DUI? and they were mad when we did this. Really. They were mad when we did this. So under our EAP, our number 1 used benefit is home safe. If after school you go down to wherever, if you're going down to Bergs and Bridgeville, and you look at your watch and you got there at 4:30 in the afternoon and it's not 11:45 at night, call an Uber, all right? We will pay 3 times a year per person, $25 to get you home safe. All right? Now, who uses this the most? I don't want to say my teachers, but their children. And so I stress to the teachers, if you've got a child at Pitt or Duquesne, and they're on the south side, and they cannot get back to the dorm or their apartment, get an Uber, keep the ticket, $25, we pay for it. Now ladies, I always tell the ladies, if you're turning 50, we ain't paying for the party bus, all right? If you want to throw 3 or 4 ladies in the car, we'll pay the $25, but we ain't paying the party bus. So that's our #1 EAP use.
So this next slide really tells you the results of what happened since 2020. You can see the savings that we've had, and then the premium increases that we've incurred from year to year. And as Mike said, we haven't, other than that first year, there's really not been an increase over 5%, and many times under 2%.
And I don't care if you're a hospital, because sometimes the hospital benefits are not primo, and your rate increases have been high. So here we go again with the Stowe Rocks of the world, or the East Alleghenies, Duquesne, Wilkinsburg. They're never going to get a rate increase like that at 1 or 2%. All it would take, and I'll pick on South Fayette. We have 250 people in South Fayette. We've had, honest to God, we've had at least 1 or 2 tragedies a year. They couldn't afford a rate increase of 30 or 35%. But because we're so big, it just doesn't matter. 1 year it's South Fayette, next year it's Bethel Park, maybe it's Fox Chapel. But no way would those increases be that level without the community support of the consortium.
A little bit about the impact to districts. Mike's talked about it. Yeah, all the things that Mike's said, but also for us, it saved money that we can put toward other things in the school district. I can now afford to buy new technology and updated technology. I can do some of the infrastructure improvements that I've perhaps been putting off for years when I'm not paying such high rates for health insurance. We are limited by our tax rates by the PDE index, so we have a limited number of sources and ability to raise income now. So all of those have helped. The other thing is that it's been alluded to already is when we go into negotiations with labor unions, we no longer haggle about the benefit and the level of benefit. All that we haggle about is how much they're going to contribute to the cost of the premium. But that's the only thing on the table. So it makes labor negotiations much easier and much more simple to deal with. Pharmacy, you want to talk a little bit about that?
No, that's your
That's
baby.
me?
Well, no, listen, I already said to you at the very beginning that I thought the insurance companies were hiding and we weren't sharing information. Come on, people. That's the new area that nobody knows about. It's like squeezing if you got a balloon and you squeeze in the middle, the air goes to it's the same way. We can't keep up.
Right. So we have recently moved to a PBM pass-through model. We issued an RFP a few years ago. We continue to work with ESI and Highmark, but we are currently in the process of issuing a new RFP. We did a recent market check and realized there was a lot more savings out there to be had. Then we're also we instituted a new program called Copay Armor, where we're recouping coupon savings on specialty drugs. And then we're also looking at things like diagnostic reviews and especially patient case management, those types of things that everyone's trending and talking about now. We're trying to stay ahead of that. The results of some of the work we've done, you can see the numbers there. We've saved $5 million a quarter since 2019 by using a new PBM pass-through model. Our recent market check that we just did last year saved us a net of $7.5 million. We have customized our formulary with our PBM, so we review that every quarter and remove wasteful spending on drugs that don't have any efficacy value. We can use a different level of dosage or a different generic type and save money. We've saved about $4.9 million annually by doing that. And then the Copay Armor program, which is new this year, we just started it this spring, has netted us $3 million in savings in the past 5 months. Along with that, our members have saved almost $80,000 because they're not paying higher co-pays for those specialty drugs because they're getting the coupon discounts, the way we structured it. And this is just a graph to basically show you over the last 5 months. The red line across is really Innovo's book of business in the same market of what at the averages and what they're paying per month. And then the blue bar represents what we've been paying. So you can see that the savings are working.
But not, and just to go back, Doug, I mean, Doc, how often do you have to negotiate with the AFT?
Once every 4 years.
Once every 4 years. You can't do this once every 4 years. And that's what happens when the schools were individually trying to negotiate. You can't be every 4 or 5 years and look at this. Doug and Dave, how many meetings do we have a month?
Well, we have 2 trustee meetings, but I literally am in probably 3 or 4 a week because we're constantly staying on top of these
Well,
things.
and how big, Doug, is Bethel Park's budget?
90 million,
And how big is our budget?
340 million,
So,
50 million.
and we do it with how many employees?
None,
We don't have any employees.
0.
So we're all
We're all
hired guns.
volunteers.
Yeah, no, some of us get paid.
You get paid.
I get paid. But this is, I mean, again.
We have consultants that get paid.
Yeah, well, Bethel Park can't do this by themselves. They don't even know how do they ask? And the carriers, they're thrilled when nobody asks. Because when you ask for their information, well, you're not big enough. It's HIPAA. I mean, but with this, we're able to help every one of the schools. And not only the schools, as Doug pointed out, all the taxpayers.
And one of the things I'm most proudest of is, and this has been proved to be truthful, is we have no interest in a high deductible plan whatsoever. We know from other states, high deductible plans don't work.
Well, and lately, if you've been reading information about it, now they're coming out saying that the janitor, the cafeteria worker is putting off going for their wellness, and then when they get super ill, now they show up and cause a catastrophe claim. So we don't want that. Please go and use your wellness.
This is just a summary of our plan and the deductibles, the drug deductibles, and then what our monthly rates are for the different coverages. So again, we just have the PPO and the EPO plan, and the networks mirror each other.
They're identical. And I know that you probably don't know, but these rates, we have 71 schools today. What's happening, Doug and Dave, July 1 of 2020?
18 more coming in.
Yeah.
And it's just because, it's not because we three do a good job. It's these rates. I mean, some of these schools coming in, their family rate for this type of plan is $2,500 or $2,600.
We have one trustee who would go to various entities when they wanted to hear what we had to say, and she would say, well, we can help you, but there's no way your rate should be lower than ours. That was about 30 districts we did. How many of those districts had lower rates, Mike? None. They were all higher than ours, and we're in a more expensive level of health care.
Right, you would have thought that the Allegheny County School Consortium, our rates had to be higher. We're in the middle of Allegheny County. Some of these schools, we go as far as Grove City, and we've got a meeting, which I don't even know why we're having a meeting with Red Bank this afternoon. and you would think, what are you talking about, Red Bank? You guys have elk. You guys shoot deer for your dinner. How can your rates be higher than ours? But they are. Why? Because they're all singular, individual, and the insurance companies don't care. Here's your rate increase.
That was quick, but I wanted to be conscious of the time, and I knew we were running a little bit late. So if you have any questions, we'll be happy to take them. I don't know how we are in time.
We're about 15 minutes behind, but that's okay because we can make it up. But so maybe a couple questions.
And then if we'll be around today too if you have questions. Go ahead.
Who is in your network? Who are your providers?
We use the Highmark AHN network for the most part. Yeah, they're our delivery systems because we didn't want to have to build a network of doctors, so we've been partnering with them.
But every community hospital is in the
Yeah,
network.
yeah.
So the butlers.
The independents.
And now I'm going to double talk you. After the divorce was remedied, we even use UPMC when they're single source. So we do go to Northwest UPMC or Somerset UPMC. They're in our
And
network.
we go to Morgantown too.
And,
Do you have a children's hospital?
Yes,
Oh.
his children.
oh my God, yes. I mean, we couldn't live without
Yeah.
children's.
We're from Lancaster County, so it's great to see. First of all, I just want to say thank you for doing this for our schools, because if we learned anything this year, they are the backbone of our community, and it's wonderful. We should uplift them first. I'm just curious, so schools, and we have 16 school districts in Lancaster County, and you can show all these benefits to economies of scale when you're dealing with health insurance. Why don't schools do this with other things like administration?
Yeah, I think it's going to become a trend, and I don't want to go too far into it, but I think that I'll be shocked if in 10 years there are still 499 school districts in Pennsylvania. I mean, we're at the point now that they have to start combining and sharing resources. There is a level at which school districts can be too big, but there's also, you can't run a school district and be graduating 100 kids in a class. It's just too small. You're not doing your kids any justice, but that's kind of off healthcare. But I think you're going to see more and more of that. I think there are some school districts out here in Beaver County that are sharing business departments. I think you'll see that trend happening more and more.
And you might get away from the disparate sort of things that happen at the school board level. And when we looked at school district vaccination rates in Lancaster County, we had one school district that had a 70% vaccination rate and one that had a 22% vaccination rate. And I knew there would be disparity. But to that level, it makes no sense.
No sense.
And so I'm wondering if within your consortium, because you have this more collaborative and unified approach, you also have a public health department, which we don't have in Lancaster County, but have you looked at that as a marker
We
of
do get
success?
reports from Highmark and Innovo about the COVID situation and the vaccination rates, and yes, they do vary. I mean, when you're looking at a Stowe Rocks which is much more ethnically diverse and a lot more black citizens, there's this skepticism, and it's existing nationwide, but it's no different here too, because the vaccination rate there is not as high as someplace like Bethel Park, which is, upper suburban.
We see a rural-urban divide.
Yeah.
kind of thing.
But you hit it on the nose. Dave and Doug, my number one rule of thumb of the whole world is
Everybody's
Balls for
greedy.
everyone.
Yeah.
Everyone's greedy.
everybody's greedy. And the school boards are at the top of that. As I talk to different school board members, because we have them on our board. Now this is craziness, but the one guy from a very small distress towards the east said, Mike, how could I suggest to my school board that we merge with West Jeff? And he said, Mike, the football boosters would kill me. And you've got these little, no, seriously. You'd have the football.
Yeah.
The first meeting I had with Dr. Lou, and I won't say, I couldn't get in his office. There were parents screaming bloody murder for his name. So I finally got in. I said, Lou, what the heck did you do? He said, oh my God, I fired the band director.
My first superintendent told me every critical decision you make at the school board level involves balls, beans, or buses. That's it. You never have any meaningful conversations about curriculum.
Right now, there are 500 school districts in the state of Pennsylvania. I can give you 4,500 reasons why. 9 times 5.
I just wanted to make a comment. When I first learned about your work and had an opportunity to interview Janice Klein, who was a part of this
Right.
Yes.
way up, she's retired now. The thing that shocked me, not knowing anything about how schools really are run and managed, is the hatred that labor has for the school board and vice versa. So that they won't talk, they will only confront, they will only challenge. And the work that I guess Janice and some of you did to get them at the table and to recognize that the insurance companies were their mutual enemies that were playing them because they weren't working together. So I just want to commend you for that happening. And I think for a lot of the independent school districts, that issue is all across the country.
Yeah.
So I
It's
just
a good
want to
point.
commend you for doing that.
Thank you.
Thank you.
I think we
Thank
probably
you,
should
everyone.
take our break now. So thank you.